Awesome. Thank you for doing such a great job behind the scene. Michael is our broadcasting specialist behind the scene. Here's my sinus lifting. Don't get confused. This is your zygomatic arch. This is not your sinus. This is not the floor of the sinus. It gets superimposed. This is actually the sinus lifting. And here's your implant opportunity, having 3 implants, 3 crowns versus a young patient in her 40s wearing a denture. Now she has fixed dentition. I run into her every once in a while here in Beverly Hills, and she's very appreciative. I usually see her in a restaurant, so she's probably using those implants to function with and be happy with. And that's what I want for you. Here are the eggshell sinuses. For these, you really need to create bone from nothing. Don't push the envelope. Don't place your immediate implants. Okay. And you can place your implants in good bone. I like to wait for my sinus lifts to heal for at least 4 months, because with sinus lifting, if you do it in a safe and predictable way with clarity, you're going to be serving more patients, increase your menu of treatments. You're going to be a better diagnostician, perform many more implants, double your implant opportunity. I wanted to share with you also what not to do, what type of sinuses you don't want to touch. Okay, sinuses that are diseased, that are fully obliterated by the membrane, with polyps, with infection, with pus. Sinuses where in the cross section you see one sinus that is pneumatized, the other sinus is completely obliterated. Don't touch those sinuses. Refer them out. Send them to an ENT. Don't touch sinuses that have different septi. You see, this is an extension of bone into the sinus. Yes, there is a solution for that. Here it is, right? Here's the septum. It's kind of connected here. If you fall into this trap and you start to lift the sinus, you're going to lift it to here and you're going to leave a void behind. Okay? So don't touch those sinuses, at least not at the beginning. You want to become more of an expert. You want to master that first. Sinuses that are full of pus, don't touch them. Don't think this is a huge membrane. This is just a big mucus seal or just big pus inside the sinus. I send the patient to an ENT and get it cleared. If it clears enough for me to do a sinus lift, great. If it's not clear, I'm just not touching the case. I'm sending him out.